Thank you, everybody, for coming. I appreciate your time. My name is Mezie Okolo. I represent Right Place Health Initiative. And today we're probably going to go through my schedule for this meeting. Then we'll take the questions, if any. We need to understand that water is very important for human existence. And in Nigeria, as a case study for the whole of the rest of Africa, the quality of the water that we drink cannot always be guaranteed. And we have instances when we have been involved or known people who are involved in drinking water that is not of optimal quality. In day-to-day discussions around water around here, emphasis is always laid on access. The problem with that discussion is that every time access is discussed, there is an underlying assumption that quality is implied. Apparently because we assume that people who produce and distribute water understand the importance of quality, but that is not the case. Now, what makes it even more serious is that when you have access without quality, that is waterborne disease, that is diarrhea, that is cholera. And so it's also possible that our people from their meager income go to the market and buy cholera, and buy the dysentery, buy diarrhea, buy typhoid. And this is what got us thinking that there is a need for us to highlight quality in the discussion so that it is no longer assumed. And this is why we are here, and that is what public health requires us to do. Now, talking about neglected tropical diseases, most of neglected tropical diseases are also waterborne, or water-related, or water-associated. Now, what annoys us in that term called neglected tropical diseases is that it's not just the disease that is neglected, but the people. Because it is people that suffer disease. So every time we talk about neglected tropical diseases, you're actually talking about neglected tropical people. And who are those people? Our people, our brothers, our sisters, our neighbors. So let's say, for example, people who have guinea worm. It is not their fault that they were born into the environment that they find themselves. They don't have access to good water. So the ones they drink give them guinea worms. And they are living with this problem. Nobody wants to live with a problem that he has the resources, the wherewithal to address. And so because these ones are mainly poor in rural areas, they tend to be abandoned and neglected. And so anytime there is something we as a people, as a government, as individuals can do to alleviate the problems of people like that, and we don't do it, then we are guilty of neglect. And I think that is not fair. Now, moving from there also, we notice that in the primary health care system, most of our primary health care systems are suboptimal in their functions because they don't have what they need to function. And one of those things that they don't have, which is critical, is water. A lot of the primary health centers, in Nigeria, don't even have access to dirty water. How much more clean ones? Now, primary health care is the place that all of us are supposed to go to get our routine medical checks. That's where women go to do their antenatals. That's where we take our children for vaccinations. So you can imagine that they don't have water to even wash hands. We're not talking about the ones that they even use for other things. So that is nosocomial infection there. That is infant mortality. That is under 5 mortality. That is perinatal mortality and morbidities. And we think that is not fair. So now I have talked about water, talked about neglected tropical diseases, and I've talked about primary health care. These 3 areas are the major areas that Right Place decided to get involved in to address. So when we set up Right Place, our vision was very clear: to ensure an Africa where nobody suffers from waterborne diseases, and an Africa where nobody suffers from what is called neglected tropical diseases, and an Africa where every primary health care facility has what it takes, the basic water that it needs for its optimal discharge of its duties. Looking at those 3 major areas, we give ourselves a challenge. The challenge to see to it that we take steps, right steps in the right direction to address some of these needs. It doesn't mean we have what it takes by ourselves on our own to do all of that. And that's why we call on our philanthropists, the governments, the private sector, development partners. We call on individuals, people of goodwill, to identify with Right Place as we identify these high need, hard to reach areas. It is our opinion that the statistics that we have about some of these mortalities and morbidities are really conservative, to say the least. Because by the time we start looking real deep into the rural communities, we think there's bound to be people who have been abandoned and who don't count in some of the things that we have counted so far. No thanks to dirty water. People are dying as we speak. No thanks to dirty water. People fetch water to go to work in primary health care from their houses. And in this water, they fetch from their drums, from rainwater. So you can imagine how clean such water is. But then if they don't have anything, they have to use what they have. But then what they have is not helping us. And we are really very much concerned about it. And what is even more serious is it is important for us that we understand that this fallacy that is subsumed in the assumption that quality is buried in the supply and access to water must be addressed and addressed squarely. Beyond Access was initiated to call together to the round table all the major players and partners so that we can have a robust conversation and see what we can do and how all hands can be on deck. Because we believe in Right Place that waterborne diseases can be eradicated in Africa, but we must all join hands and make that happen. How do we join hands? However we know to do, whatever any individual has strength in doing, they should be able to come, to the round tables and help us refine and, if possible, challenge our ideas. We are happy to be challenged, and all of us will now come together or agree on what we should be doing going forward to ensure that these issues are being addressed. We have gone ahead, because of the importance of this subject, in our opinion, we decided that we're going to make this conference a free conference. So that means attendance to the conference is going to be free to whoever that wants to come. But we require pre-registration. The reason you have to pre-register is so that we'll be able to plan accordingly. Otherwise, if you don't pre-register, you can still show up at the conference, but you may not be able to have access to certain activities during the conference. And 2 things are going to happen at this conference. One, we're going to inaugurate our volunteers. We call them Beyond Access ambassadors. What are they going to do for us? These are people that are going to be our eyes, our ears at the grassroots. We will have them at the state levels, at the local government levels, at the city levels, and the town levels. And these are people that will help us to identify, number one, cases of waterborne diseases that are otherwise unreported and unnoticed so far, so that we can take steps to address them and take steps to address their issues within their environment. Two, they will also help us identify incubators and what I call perpetrators of waterborne diseases. People who package water at the back of their houses and label NAFDAC number on it and sell on the streets. Somebody has to be able to say to them, this is not going to happen. This is not fair. This is not good for the community. And we are happy to champion that resistance and help whoever is responsible at the government level that is missing some of these counts to count them properly and to address them properly. What else will our ambassadors do? Our ambassadors will be able to collaborate with us and be our hands and our feet, because I cannot go to everywhere. But I can put together some proposals or some package that could highlight to a potential partner what is happening in some remote village in Kaduna State or Kano State. And maybe somebody who is interested from there will be able to help us provide those services that will address the community. Now, in trying to provide water for the community, we also have in mind that because of our interest in primary health care, that whatever service we're going to provide will be able to be situated somewhere that will benefit both the primary health care and the community. So it will be a dual benefit to that community. And of course, if we do that in partnership with the community, there is now no ownership. Of course, for every project that you do in the community to survive or to be sustainable, there has to be ownership, community ownership. So it will be our interest that the community will be partners with us to be able to execute some of those projects, and then they can take ownership and make sure that it is sustained. The second thing that's going to happen at that conference is the launching of our magazine. We call it the Beyond Access Quarterly Magazine. What is the magazine going to do? It's going to capture what we are doing and what other people are doing. It's going to show us what good looks like and what bad looks like. And then, of course, it's going to be a chronicle of our activities and show us milestones, what we are doing and what we should be doing and what everybody should be doing and what the conversations are. They are also be able to highlight what waterborne diseases are doing in the areas that are affected and which ones are doing what and how well are we doing. For example, when we talk about cholera, we'll be able to capture how well are we doing with cholera. We'll be able to capture some of those issues, and every quarter there will be a new release that will keep us abreast and track our activities going forward. It will be our interest to train our ambassadors so that some of them also will be useful for us in the magazines as we put all of these structures together. Now, finally, what else is the conference going to do for us? It's going to help us have a robust platform for partners, long-term ongoing partners, beyond the ambassadors. We're going to need partners that will help us understand the vision of Right Place in line with water quality and help us run with this vision to where 5 years from now, we want to look back and see that at least in every local government in Nigeria, that there is something that is standing, that is helping primary health service, that also shows what good looks like. So that if there are other people within that community that want to copy what good looks like and duplicate it within their areas, they can see what good looks like. And we are hopeful and confident that by the time we are taking some of these steps, we will have been able to help drive down the statistics as far as waterborne diseases are concerned, as far as inherited tropical diseases are concerned, and of course, some of the morbidities and mortalities that are recorded in our primary health care services. At the end of the conference, we're going to have a dinner. And that dinner is an award night. Basically, we're going to be giving award to some awardees in celebration of their, their input and their effort towards the upliftment of humanity. But more importantly, that award will be an invitation to partner with us as we make this journey. We are starting with Nigeria, but our catchment is actually Africa. Because as we speak, we already have people from different parts of Africa, from Kigali, from Uganda, from Malawi, who have already expressed interest in being part of this. And so we are hoping that as partners come on board and as our operations expand, we'll be able to reach out to all of Africa as God helps us. Thank you very much, and you're welcome.
All right.